Hi everyone, welcome back to my channel. In this video, we are going to talk about one of the most important subject in 4th semester, PPG, which stands for Pharmacology, Pathology and Genetics. This video is going to be your complete guidance for PPG. I'll explain how the question paper is framed, how to write your answers in the correct format, and what are the most important topics that you should focus for the exam. And at the end of this video, I will show you a previous year question paper and explain how questions are usually asked. So don't miss that part. If you are someone who feels confused about what to study, how to start, and how to write answers, this video will clear everything step by step. So let's get started with our complete PPG guidance. First, we'll see overview of PPG. Before we get into the paper pattern and answer format, let's first understand what exactly PPG includes. PPG stands for Pharmacology, Pathology and Genetics, and these are the three subjects are combined into one paper for your 4th semester. Okay, Pharmacology is all about drugs, Pathology deals with disease, and Genetics is about hereditary and inheritance. Now we already completed what are the subjects we are having, and now we'll move on to paper pattern, how questions are asked usually for our semester batch, and previously the pattern was different, and from your semester batch onwards the paper pattern was different. So let's discuss how the question paper was given for your semester. So PPG question format is divided into two parts. Section A includes Pharmacology 1 and 2, and section B includes Pathology 1 and 2 and Genetics. So in this we'll take a break, and I want to clear a doubt that so many students are having. Are we need to study Pharmacology 1 and 2 and Pathology 1 and 2? Yes, definitely you have to study Pharmacology 1 and 2 and Pathology 1 and 2 for your exam. So now we cleared one point. Section here for PPC you have two parts, that means two sections. Section A includes Pharmacology 1 and 2, and section B is for Pathology and Genetics. So in section A, Pharmacology will be given like this. First Roman will be MCQs, 7 questions will be given, each carries 1 mark, total 7 marks. And second Roman will be long answers. So one long answer will be given, each question carries 10 mark, so 10 mark. Short answers, they'll ask 3 questions, each carries 5 mark, and you'll get 15 mark. And very short answers, 3 questions they will ask, each question carries 2 mark, you'll get 6 mark. Okay, so total for Pharmacology, total you have 38 marks. Remember one thing, you won't get any choice for any question in Pharmacology. Okay, so section A carries 38 marks, only Pharmacology. Okay, now section B we have Pathology 1 and 2 and Genetics. Now first we'll start with the Pathology. For Pathology they'll ask 1 mark question, that is multiple choice answers. 4 questions will be given, each carries 1 mark, 4 marks. And then we have short question answers, that means 3 questions they will ask, each carries 5 mark, there you get 15 mark. And very short, 3 questions they will ask, each carries 2 mark, 6 mark. So total Pathology will be 25 mark. And when it comes to Genetics, only multiple choice will be given, 3 questions will be given, each carries 1 mark, so you get 3 mark. And one short question will be given, 5 mark, and 2 very short questions. So that means 2 mark questions will be 2 questions, you get 4 mark. So total 12 mark. So when we combine Pharmacology, Pathology and Genetics, we have 75 mark. So this is the pattern for Pharmacology. So let's take a overview. Pharmacology 1 and 2 38 marks, Pathology 1 and 2 25 marks, Genetic 12 mark, total 75 mark. So this is the pattern for Pharmacology. Before going into answer format, how to write answer for Pharmacology, Pathology and Genetics, first we'll discuss Major doubts regarding pharmacology. When you are writing PPC question paper, you won't get two booklets like where you get for some previously when you are writing microbiology and something you get two booklets, right? You got two booklets like that. You won't get two booklets. PPG will be one booklet, so total marks will be 75 mark. Pass mark is around 32 or 38. I think 38. I think so. So if you are getting 38 in pharmacology and you're getting 0 in pathology, 0 in genetics, you are passed. Or you are getting 8 marks in pharmacology and 20 marks in pathology and genetics, you got 12 marks, you will be passed. Okay, all over you need to get 38, like whatever the pass mark. I hope 38 is your pass mark. So if you are getting 38 mark, you will be passed whatever subject you get. Okay, this is a major doubt for all the students. So I hope this question was cleared by this. And now we will go to the answer format, how we need to write the answers for pharmacology. Now that we understood the question paper pattern, let's see how to write your answer for pharmacology. In pharmacology, your marks mainly depend on how neatly and systematically you present your answer. So here is the perfect answer format you can follow for any drug related questions. So this format is for drug related question. If the question paper contains like describe about diuretics, it is a drug based question. This is for that question you have to follow this format. First we need to write introduction, next definition, after that classification. When you are writing classification, in last class we discussed about respiratory drugs, right? In that we discussed bronchodilators. For example, bronchodilators, they have some classification. So while you are writing classification, you should write in a flow chart, and you need to, for every classification, you need to write at least one or two examples. Okay, when we take second generation medicine, we need to write citrazine, for example. Like that, when you are writing the generations or when you are writing classification, each classification you have to write one example. Next, after classification, explain the part asked in the question. As I mentioned earlier, the question explain about diuretics. They asked about the diuretics, right? Now after classification, we need to write the part asked in the question. What are diuretics? What for they used? Like that we need to write. After writing the mechanism of action, if they are mentioning any drug, we need to write a mechanism of action for the drug, and dose, frequency and route. After that, indications, contraindications, adverse effects. After that, side effects or adverse effects are the same. Then uses, nursing responsibility, conclusion. This is a format for 15 mark, 5 mark questions if the question is related to drugs. Okay, if it is a 15 mark question, write introduction, write conclusion. If it is 5 mark question, start from definition, end with nursing responsibility. No need to write introduction and conclusion. This is the main thing. Okay, so if they are asking about any drug, you have to follow this pattern. If they are asking asking questions like this, role of a nurse in a treating paracetamol overdose or principles of prescribing, these type of questions which where they are not asking about drugs. In principles of prescribing, they are not discussing about drugs, right? They are asking principles. For this, how we need to write answer for those type of questions, like what principles of prescribing or role of nurse in treating paracetamol overdose. There is no need to write all these things like a mechanism of action, doses, indications. First you need to write introduction, after that definition, after that what they are asked, they asked principles, write principles. That's it. There is no need to write anything other than that. Directly write these principles, you will get 5 mark. Okay, if there is a chance, if they are giving any choice, for last batch they didn't give choice. If they are giving you choice and you have to choose between this type of question and a drug, try to choose this type of question. Okay, writing principles or role of nurse is, it will be easier than writing a drug where you can't remember classification doses correctly. So it depends on you, completely depends on you. If they're asking about the drug, this is the format you have to follow. If they're asking about anything prescribing or principles of a nurse or something else, you have to write exactly what they asked. Important topics for pharmacology: antihistamines, diuretics and antidiuretics, drugs acting on nervous system, cholinergics and anticholinergics, drugs acting on gastrointestinal system, antibiotics, cardiovascular drugs, drugs acting on endocrine system, respiratory system drugs, drugs used in pain and inflammation. These are the main and important topics in PPG. Yeah, now we completed pharmacology answer format and important topics. Now we dive into pathology answer format. How we need to write pathology. First, if they are asking any kind of disease condition or anything, they have to write introduction, definition, etiology or causes. After that, pathogenesis, morphological or structural changes, clinical manifestations, complications, nursing significance or management, and conclusion. This is a pattern. Okay, important topics for pathology: diseases of respiratory system, diseases of cardiovascular system, wound healing, neoplasia, arthritis and meningitis. Okay, this is the format and important topics. Now, why we are not discussing the format for genetics? Because in genetics, see, this is the last year paper. Let me zoom it for you. I hope this is the section B. See, in genetics, they only asking one short answer. There is no long answer, only short answer. That to parental diagnosis. There is no particular format for genetics. Whatever they asked, just write regarding that and in a point way, not in a paragraph. That's enough. There is no particular or a sort of format for genetics. Now we'll discuss last year question paper so that you'll have some idea how they are asking. See, in section A, as I said, they gave multiple choice answers, and now we'll see this. See, there is no choice. They only gave classify NSAIDs and write mechanism of action, uses and adverse effects of paracetamol, role of nurse in treating paracetamol overdose. Okay, this is the this is the first essay question. And here when you see role of nurse in treating paracetamol overdose, this particular disease we discussed in last class in respiratory drugs. When I'm explaining, I think second part, I think so, we discussed a drug which treats overdose of paracetamol. If anybody remembers, this is the question related to that drug. Okay, and second topic is, second Roman is 3 short answers. So write an account on metrozole and give a detailed note on nitroglycerin. Explain about role of antacids in peptic ulcer. These are the drugs. Questions will be like this. Okay, when we come to pathology, here no long answer, only 5 mark questions are there. Vascular and cellular events after acute inflammation. And in genetics, only 1 short and 2 very short questions are asked. This is a format for PPC. Importance and purpose of this section, like why we discuss about this class or why everybody need to know about the format, is this section aims to provide a clear understanding of the core subjects pharmacology, pathology and genetics for BSc Nursing students. It emphasizes the relevance of this field in nursing practice, helping students prepare effectively for exams and clinical responsibilities. Mastering PPC enhance the ability to deliver comprehensive patient care. Now we conclude this, like this, why you came and watched this video, because with this video you'll get an understanding how the question paper was asked. Okay, and how you need to attempt the answers. You right now, at the end of this video, you all know how many questions are asked. what is the pattern for the question paper, and how we need to write questions for PPC, especially pharmacology and pathology. So this video gave you an outline how we need to write the questions. So what are the topics you need to cover, what are the important questions, or what we need to study, or what we need to focus clearly. This is the main problem, right? So for that, I'm making another video, the upcoming video, where I'll make a complete study plan for PPC. So make sure that you hit the bell icon, like you hit the subscription button and hit the bell icon, so that you'll receive the notification whenever I post the video. And make sure, if you like this video, please like and subscribe and comment your thoughts. And if you're having any doubt in this video, please definitely comment. And everybody having my number in Telegram. If you're having any doubt regarding your semester or your exams, try to DM me. And don't miss the next video. It is very informative, and I hope this video gave you a complete and informative things regarding PPC. We'll end this video. Thank you so much for watching. I hope you'll enjoy the next moment. Thank you.